Hi, welcome to the Destin Business Forum, brought to you by the Destin Area Chamber of Commerce. I'm your host, Amy Perry, and our first guest is Dr. Stephen Clark, a board-certified plastic surgeon. Dr. Clark, you have offices at Sacred Heart, at the medical offices at Sacred Heart, and also in
Bluewater, Niceville.
Bluewater. So you have two different locations, but primarily you're located in
Miramar Beach at Sandestin, right next to Sacred Heart Hospital.
Okay, all right. And what do you do in your practice primarily, or do you focus on just?
Primarily, my practice is cosmetic or aesthetic surgery, but we also do some of the reconstruction aspects of breast reconstruction, and as far as emergency care, I do cover maxillofacial trauma, but primarily we do aesthetic surgery.
And if people get bitten by a cat, you help them with that too on their face. Full disclosure, I know that you helped me out when my cat bit me and I had a really bad bite on my face, and you helped me out a lot. I appreciate that. So tell me, I've heard a lot about fillers that you can do at various places in your face. Tell me about fillers.
Well, the trend in plastic surgery is towards non-invasive, and many people would like correction with little downtime, with improvements that make differences, but will not take them out of work, etc. And fillers have increased in number. I mean, there's many different types of fillers, but I think what is key is which filler. Certain fillers work better in certain areas, and that's something someone who is experienced with fillers has to make a judgment for a particular patient's problem. Well-known fillers are Juvederm, Restylane, and we use a product called Radius, but they're not used in the same areas for every patient, so I think that's critical with the plastic surgeon making that decision on which would work best.
So do fillers go in, I know they can go in your lips, and they go in the creases.
In wrinkle lines.
Okay.
Fillers are a little different than Botox. I mean, Botox is also a non-invasive conservative treatment. Botox will improve wrinkle lines by relaxing muscles in particular areas, and can also improve brow position for a lot of patients. Fillers really sort of improve both lines or wrinkle lines, but now there's a big push to improve the volume of the face, where patients have lost certain volumes, and is basically with aging they lose volumes, and certain fillers can improve those volumes.
Would you, if you're thinking that you may want to delay the effects of aging, but you don't want to do a facelift, or maybe it's not time for that, are fillers something that you would consider before a full
Right,
facelift?
it would be based on, of course, physical exam and what the patient's desires are. I mean, there are improvements you can make with fillers. They're obviously different than surgery, but for patients, and particularly patients who are beginning to have certain changes with age, I think fillers will improve many of their concerns.
Is there anything that you do short of like full facelift, or is it fillers or full?
Well, I think based on, as I mentioned, exam and what the patient's concerned about, for an example, the mid-face area is a very common area early in aging, where the fatty pad of the cheek,
Is that just
right here, there's a fat pad which generally begins to descend in probably the late 40 region, and that really changes shape. It really changes the look of youth, and many times we can do a non-invasive, or I should say limited invasive procedure, where we can change shape and volume, and that's the new new focus on plastic surgery, to not tighten tissue so much, but to change shape, whether it's with a filler or whether it's surgically, to have someone look relaxed but more youthful, and a very natural appearance.
Because it seemed like you know, a long time ago when people had facelifts, they just looked pulled and tight.
Right.
And now, some people you can tell they look a little different.
Sure.
But I've seen some people that have told me they've had something done, but it's very subtle and it looks really good.
Right.
I mean, really good.
I think that's a compliment when someone has had something done and they look refreshed, they
Right.
look like a more youthful look, but you haven't really changed their personality.
Right.
And I think that's what we try to do. I mean, and that's really based on training, experience, and having a good focus and three-dimensional eye on recreating some of those signs of aging.
Do you ever have to tell patients no, or let's be a little more subtle? Trust me, you'll like that
Right.
a lot.
Oh, without I don't operate on everyone. I think that we have to really be clear, and they have to be ready for change. And I think that that's my job in sort of discussing different options if they are a surgical candidate, and making it clear with what we can do and what we can't do. But I feel experience and my training with a cosmetic fellowship makes a difference in my approach.
Okay, I have a little bit more time left, and I have a couple of questions to ask you. How long have you been a plastic surgeon?
I've been in plastic and reconstruct for almost 20 years.
Okay, all right. And what are the new things? We talked about the mid-face. What are some more new things that you are doing in your practice?
A small procedure which is relatively new but we find works is for the patient who's interested in lip augmentation. Traditionally, we would inject the lip with a filler, but that becomes something that has to be repeated. Sometimes it can be uneven, sometimes based on how tissues expand. It may not look exactly the way a patient wants. A new procedure that we've started is called PermaLip, and I've treated many patients for lip augmentation with many products, and I feel this is the best one. It's a office surgery, outpatient. It's done under local anesthetic, and it's a small silicone strip, and it is permanent. It takes about a half an hour to do, and we found I've treated about 30 patients now. They're very happy. They don't have to repeat the process. They have actually excellent form to the lip, and it looks very natural. It does not look overly done, which I feel doesn't match many patients. You know, you can't really put 20-year-old lips on a 50-year-old.
Right.
So I think this has been a successful product for us.
Good to know. And we have about 15 seconds, but I have to know, you've got like an Egyptian-looking lady on your jacket. Tell me as quickly as you can, what is that?
That's a logo from the American Aesthetic Society. It's only for board-certified plastic surgeons who have achieved a certain level in cosmetic surgery. Not all of the board-certified plastic surgeons can achieve that. And the logo is actually Nefertiti, who was an Egyptian queen, and it represents endless beauty. But I think it is important, if you're considering plastic surgery, to see if someone has achieved that.
Sure, do your research.
Yes, do
Okay.
your homework.
Dr. Clark, thank you for joining us.
Okay.
Please come back.
Thank you very much. I appreciate it.
We'll be back.